بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص بوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My short talk today about butterfly sign and bat wing sign in imaging. Let us see some examples of these signs. Here, chest X-ray, as we see bat wing or butterfly sign representing at pulmonary opacities, bilateral, starting from perihilar region extended to the periphery, and it is classically described in pulmonary edema. And these bilateral airspace opacities has another differential diagnosis, include infection, pulmonary hemorrhage, or alveolar proteinosis. Here, this is a patient with coronal CT scan, and we see butterfly appearance in patient with high-grade glioblastoma multiforme, grade 4, crossing the midline via corpus callosum, giving the appearance of the butterfly with symmetric wing-like extension across the midline in this patient. Here, another patient with glioma, malignant glioblastoma multiforme, here posteriorly crossing the corpus callosum in the midline, and here anteriorly crossing the corpus callosum in the frontal region. Here another patient with crossing corpus callosum posteriorly. Also, butterfly sign or butterfly vertebra is seen in the spine, and it is called butterfly vertebra, and it is a rare congenital either symmetric or asymmetric defect in the sagittal cleft of the vertebra, and it is caused by persistence of the notochord during the development of the normal vertebra, and usually occurring during the 3rd to 6th week of gestation, when the lateral centers of chondrification fail to fuse together, and it is incidentally and rarely cause back pain, and can be confused with compression fracture. There is widening of the lateral parts of the vertebra, and a bony bridge may or may not form between the lateral fragments, as we see here butterfly vertebra in this example. Another patient with symmetric butterfly vertebra, and here we see in the sagittal cuts, and it is incomplete fusion of the two halves of the vertebra, and this can be associated with spina bifida and meningocele. Here is another patient with symmetric butterfly vertebra with looks like compression on the sagittal view. Here, asymmetric butterfly vertebra patient with scoliosis, as we see in this coronal and sagittal uh, and this oblique AB view. Here, this patient has Joubert syndrome, and it is autosomal recessive disorder associated with a genesis of the cerebellar vermis, and we see the fourth ventricle has the appearance of bat wing shape. Here, a patient with glutaric acidemia type 1, and we see the Sylvian Fisher has the bat-wing appearance. Also, butterfly sign can be seen in the normal chord plexus during fetal brain in the antenatal ultrasound. Also, it may suggest a hollow obrosencephaly. And here, this is a patient with uh, butterfly sign of the chord plexus in patient with hollow obrosencephaly. Here, this is a patient with horizontal gaze palsy with progressive scoliosis. As we see here in the medulla, it is butterfly-like and hypoplastic of the medulla and bones, and there is in this patient it is autosomal in this disease it is autosomal recessive, and it is resulting in a critical absence of crossing fiber in the brain stem. As we see here, diffusion tensor imaging tractography showing uncrossed corticospinal tracts in this patient. Here, another patient with horizontal gaze palsy with the progressive scoliosis, as we see the hypoplastic medulla with butterfly appearance, and also we see another patient with butterfly appearance and the cleft extended from the fourth ventricle. And another patient has symmetrical dark signal in the central gray matter here and there, and it is named as black butterfly sign, and it is caused probably due to venous congestion in patient with dural arteriovenous malformation. Here we see arteriovenous malformation in this patient, and we have a dark or black butterfly sign. Thank you for listening and hoping to see you soon in another talk.